I am Dr. M. Joe Kaushik, Andrologist from Caroline John Hospital, Nagarkoil. Today, I will be discussing about the varicocele surgery which we had done for this patient, which you are going to see after this. So, this patient came to me with a history of testicular pain since 1 year. He is around 26 years old and he has gone to other hospitals and they had done a cystoscopy to check his prostate, and his prostate was normal, and he has taken antibiotics for a period of around 2 to 3 months, but his pain has not yet subsided. Then we did a scrotal Doppler and we found out that he has grade 3 varicocele on the left side and grade 2 varicocele on the right side. So then we thought we will plan for this microsurgical varicocele ligation so that his pain will be reduced. So what we did after that is we did a semen analysis and a hormonal analysis, because this varicocele has one more main impact, which it reduces the semen parameters and the hormonal parameters also will be changed. And when we saw the semen parameters, his motility was very less, which is around 13%, which has to be around 42%. And his morphology is also around 1%. And his hormone suggested of sertolizal dysfunction, which is due to his impaired blood supply to the testis. Then we planned for this varicocele surgery and the surgery went very well. What we had planned is we will do this microsurgical varicocele ligation on both the right and the left side.